Okay, so to continue, 3 reasons to control high blood pressure: your heart, which we discussed, okay? If hypertension or high blood pressure is left untreated, it can lead to angina pectoris, which is chest pain caused by narrowing of an artery, congestive heart failure, where your heart can't pump blood normally. And what will happen, or what can happen, is fluid will collect in your legs, ankles, and lungs. What do you call fluid retention or water retention? Josh, I see you mouthing it. Unmute yourself.
Edema.
Edema, okay? And then it may also lead to heart attack, which Jasmine said is MI, or myocardial infarction, which can lead to death, okay? Hypertension, how does hypertension affect the brain? Okay, with too much continued pressure inside the main artery, okay, to the brain may lead to a stroke. And that's what I'm saying. A stroke is not a problem of the heart, it is the brain. However, it is very common to see it discussed in the cardiovascular system section, because with continued pressure or hypertension in the main artery, it may, okay, pressure to the brain, it may lead to a stroke. That may lead to memory loss, speech problems, movement problems, or even death, okay? A good number of people survive the first stroke, the second stroke sometimes, but the third is so hard to survive for many. Okay, that's why they always say, oh, he had his first stroke. He has to be very, very careful about it. Okay, another organ that is affected when you have hypertension is your eye, or the eyes. Why? Long-standing, uncontrolled high blood pressure can damage blood vessels in the eyes, which can lead to blindness. Okay, what do you call that? Retinopathy. Retinopathy. Okay, that's why you'll see some people who has regular high blood pressure, they have a vein that popped in here. It tells them that the blood pressure is too high, because it can't what? The pressure is too much. It pops the vein in their eyes. Is that clear? Those are the 3 major ones that are affected when you don't control your high blood pressure, or when a patient isn't controlled. I told you I'm homeopathic. I would go homeopathy. I'm the ironic pharmacist. However, hypertension is not one thing I do homeopathic on. Okay, the drugs that are available in the market, the antihypertensives, have been proven effective. Okay, so I would highly recommend to regulate elevated blood pressure because of these 3 reasons or effects that high blood pressure can have on a person. Now let's talk about drugs. Okay, on your packet, page 11. Okay, drugs related to the heart. Let's talk about hypertension first. Okay, it says on your packet ABCs of heart medication. I'd say ABCD. Okay, your A can be your ACE inhibitor, ARBs or ARBs, right? Okay, what are ARBs or ARBs? Angiotensin receptor blockers. ACE inhibitors, angiotensin converting enzyme agents. Those are your A's, okay? What's your B? Beta blockers. What's your C? Calcium channel blockers. And what did I say? For me, it's ABCD. What's the D? What do you think is my D? What do you think is the D that I added? Diuretics. Okay, diuretics. So let's talk about these drugs. ACE inhibitors, angiotensin converting enzyme agents. Okay, so as the term implies, these are enzymes. Okay, angio is blood vessels, tensin is tension. Okay, these enzymes constrict blood vessels that causes the blood pressure to rise up. Okay, That's why the drug name is called ACE inhibitors. It stops, blocks, or inhibits that enzyme, so it doesn't constrict. Okay, is that clear? Okay, and examples of these drugs are, what do they end in? Most common suffix, Maria.
Pril.
Pril, correct. So when you see on the generic, pril, lisinopril, benazepril, enalapril, fosinopril, ACE inhibitors. Is that clear? Again, the most common suffix only are effective, okay, when you're deciphering drugs on the generic name, okay? It's only used for their generic names. You also need to remember that one of the side effects of ACE inhibitors is persistent and annoying cough. It always comes out on major exams, final exam, board exams. Number one side effect of ACE inhibitor is persistent and annoying cough. So a doctor may prescribe an ACE inhibitor such as lisinopril, brand name Zestril, monopril, brand name generic fosinopril, Vasotec, which is a popular brand, generic enalapril. And then a patient comes back, complains of annoying, persistent, embarrassing cough. So when you're working or when you're at school, it can be embarrassing when you don't stop coughing, right? So they go back or they call their doctor and complain about that because that's the number one side effect. So the doctors tend to change their drugs, okay, or their prescription. Is that clear? You have to remember that. Beta blockers, okay, another one for hypertension. Those are drugs used to relieve angina pectoris, okay? Or it's also used for hypertension. It's for post-MI, post-heart attack, post-myocardial infarction, okay? And for hypertension, like what I said. They slow the speed and force of the heartbeat. They decrease the heart's need for blood and oxygen. They decrease the heart's need for blood and oxygen, thereby increasing or easing the heart's workload. So what beta blockers do is they actually decrease, okay, the need for oxygen, okay? So the workload, you know, our heart works 24/7, 7 days a week, 365 days a year. It's like a machine that doesn't stop, okay? So there will come a point when our heart, just like any equipment or machine, will tire. It doesn't rest, not a split second, okay? So I'd like you to imagine the heart that way. That's why as we get older, this machine, this equipment kind of fails, okay? So beta blocker, what's the common suffix for beta blocker? Stormy.
Ola.
Olol, correct. So examples of drugs under beta blockers are atenolol, metoprolol, propranolol. Is that clear? Okay. Atenolol, popular brand name to Norman. Metoprolol tartrate, Lopressor. There's also a metoprolol succinate. Take note, so those are two different things. So when you're dispensing or preparing the prescription, filling the prescription, make sure you don't mix metoprolol tartrate from metoprolol succinate. Okay, and then your Inderal, which is your propranolol. Okay, fun fact, Inderal or propranolol is the first beta blocker approved in 1967. It's the first one to be patented, and the generic is propranolol. The brand is Inderal. Okay, beta blocker again is for hypertension, relieve angina, and post-MI or heart attack. Okay, Beta receptors. Let's talk about beta receptors. Beta 1, okay, is for the heart, affects the heart. Beta 2 affects the lungs. Those are receptors. Okay. What does that mean? Well, how do you remember that? I had one student and he said, Miss L, this is how I remember it. Beta 1, we only have one heart. Beta 2, we have two lungs. So we have beta 1 blocker and beta 2 blockers. Beta 1 blocker is for the heart, which is like this ones we talked about. Beta 2 blockers are usually drugs for asthma. Okay? Why? Beta 2 affects the lungs. So it constricts the airways. That's what happens during asthma, which we will talk about during respiratory system. But they block it, the drugs block it, so it actually relaxes the airways. Is that clear? Beta 1 affects the heart, beta 2 affects the lungs. Is that clear? Let's get to the C, calcium channel blockers. Calcium channel blockers are also used to relax the blood vessels, okay? So what happens in hypertension? We got constricted blood vessels, so if we relax it, the pressure goes down, okay? They're used to block the flow of calcium ions in the heart for the treatment of angina pectoris and hypertension, okay? They decrease calcium intake by the heart and blood vessels. Why? The calcium, what does the calcium do? Increase blood pressure, just like the sodium increases blood pressure. When a calcium channel blocker blocks the calcium channels, the heart rate slows down and the stress on the heart muscle is decreased. Less workload again, less stress on the heart muscles. Okay, what's common to see on calcium channel blockers? Is there a common suffix for calcium channel blockers? There's not one, okay? However, the dipin is a calcium channel blocker. What am I talking about? Nifedipine, generic nifedipine, brand name Procardia, okay? And then your verapamil is a generic, brand name Kaylan. And then another popular one is your diltiazem. That's the generic. The brand name is Cardizem. These are all calcium channel blockers. And then we have the letter D, which I've been talking about, diuretics. It's not in your packet. Okay, last one. What do I mean by diuretics? There's so many different kinds of diuretics. We have thiazide diuretic, loop diuretic, okay? And what are diuretics first? Julio, can you discuss? I remember discussing this in the audio lecture and in the previous lectures. What are diuretics? What do they do?
Diuretics are chemicals that attach to water and release them out of the body.
Okay. What do we call it? What does it do to us, Jason?
Causes urination.
Correct. Okay. A lot of students will say it makes us pee. Okay. Medical term, urination. Okay. It makes us urinate. Why? Why do we need to urinate? Of course, the excess water in the body, okay, carries salt. Okay. And water retention, salt retention causes the blood vessels to constrict, thus causing increase in blood pressure. Okay. The diuretics will make you urinate, thereby eliminating excess water, excess fluids, and excess salt. So the pressure on the blood vessels gets released. Instead of constricted, it gets relaxed. Then the blood pressure lowers. Diuretics. Okay? We're going to discuss the different types of diuretics once we get to the urinary system. Okay? But I just want you to know that the D that I added is diuretics. What's a common diuretic that we can have without a prescription available in our kitchen? Julio said coffee. Correct. Okay? That's why you will notice when you drink coffee, you urinate a lot. Okay? Because it is a diuretic. Any questions on the drugs for hypertension? No questions? Okay. Josh, do you have questions or are you just playing with your hair? Nah?
Just playing here.
Okay, I'll send you on a 15-minute break. Okay, it's 11:15. Let's come back at 11:30. Take your 15-minute break, okay? I'll see you guys after 15 minutes. We will still continue with pharmacology. So Josh, I expect you to come back. I will email Christiane that she doesn't have to come back and instead just wait for the worksheets that I'm going to be uploading. Okay? Okay, bye guys. See you at 11:30.